What is the moment or experience that highlighted your journey with the Latino Caucus?
I served as president of the Latino Caucus in the early 1990s for 2 years and as an officer for many years. I was also a member of the executive board, serving as the chair of the executive board for 2 years. I would do it all over again because it was, as I said, a tremendous privilege to be working together with so many of you that are in attendance at this 50th year celebration, anniversary, birthday of hard work, of much progress. I hope that we'll see another Latino become president of APHA in the future. We owe a great deal to Helen Rodriguez Trias, as well as to Carmen Nevarez for their leadership in being president of APHA, but there should be more in the wings ready to take on that role and that responsibility. And please know that you will always have my support.
And so one of my favorite moments is APHA, because we are working so hard to get it ready all year long. And last year, specifically 2022, was in Boston, and we were really working with a shoestring budget to put things together, because after 2 years being virtual, it was difficult. We didn't have a lot of money. So we had to figure out how we were going to pull things together, and we somehow worked it out. We did some guerrilla marketing with our t-shirts on in the poster sessions instead of doing the expo, and we worked really hard to get a nice social together, and we ended up having such a beautiful night to really celebrate all that we had come together and shared the work and the advocacy and the science that we are able to do in order to advocate for the Latino community. And that night where we danced together just felt like such a beautiful celebration of all that.
There have been many moments in this journey, including developing the first strong scientific program, which I was very proud of, in the 2000s, mid-2000s. And it was working with all the wonderful young public health leaders who are coming up and having the opportunity to mentor them. The greatest experience was hosting and developing the 25th anniversary at the Mexican Cultural Institute, where a group of about 10 local Washington, D.C., Virginia, and Maryland public health professionals met at my house to develop the entire program and the plan, and to invite, for example, Senator Becerra from California and his wife. And it was a delightful event.
My involvement really became much more significant when in 2005 in Philadelphia, we submitted the late breaker on the treatment of immigrants and refugees during natural disasters, guided by the wonderful Lourdes Rivera and working closely with Lisa Maldonado and with Miriam Granton as well. That gave me really a very clear sense of what the caucus could do, what the caucus did, and the importance of having our voice heard out loud, especially in situations where nobody else was speaking about the issues that were relevant to us. So I stayed very involved with the caucus from that point on, eventually chairing the policy committee, and eventually being nominated by the caucus to the offices of a member of the Action Board, then the board of directors of APHA, and eventually the presidency.
And since then, it has been a highlight to see that during my tenure in the leadership of the Latino Caucus, that continuity in the connections inside and outside the association meetings. That continuity it developed in friendships, not only of professional nature, but in colleagues in life. And I love to see that pipeline of the next generation of Latino leaders in the Latino Caucus moving forward.
And I felt so welcome, like I was part of a community. That act made APHA so much more approachable, and I felt like I belonged. I ended up joining the caucus at that time, and I've been a member ever since. I got more involved in the caucus a few years later. At that time, I was working at the Columbia University School of Public Health in the Department of Population and Family Health. I was at a department meeting, and I witnessed a really ugly expression of bias, and I ended up complaining to our department chair. A little while later, the Latino Caucus put a call out to help establish a listserv, and so I went back to my department chair and I asked him if the department could host a listserv, and he said yes. And setting up and monitoring that listserv was really my entree into getting more involved with the caucus. Anyway, I was in. I ended up becoming part of the caucus leadership. I was first the caucus secretary, and then I eventually became the president. Being part of the caucus for me was an incredible leadership experience. I connected with amazing people in different fields from all across the country. When I became president, I was mentored by people like Carmen Nevarez, Henry Montes, Marilyn Aguirre. Carmen helped arrange for Nancy Shemek to help us create a strategic plan for the caucus. That was really a great experience for me.
Well, the highlight of my time with the caucus has been actually in the very beginning. I was introduced and they accepted me as their secretary. New organizations are always looking for people to volunteer. And I happen to live in Washington, D.C., so would be close to APHA and some of the resources that it had to help the caucus. So at any rate, so I was secretary in the early years, 75, 76, 77, 78. And then that helped me get positions with the APHA, in fact, because in 76, I was named chair of the Equal Health Opportunity Committee. And that was because a caucus member really encouraged me to get active with APHA. And so I did, and it worked out. That kind of highlighted how I got into it and how I got to how to be involved in APHA itself. But another highlight was in meeting and working with Helen Rodriguez-Trias, Dr. Helen Rodriguez-Trias, and subsequently, when she passed away, helping to develop a video about her, and also developing materials to have a award in her name for social justice. So the Helen Rodriguez-Trias Social Justice Award was one of the things that I worked on to honor her name and to honor the work of the caucus.
To date, I know we're just around the corner for the 50th anniversary. I think to date, the most significant experience has been the 40th anniversary. It was a very special conference in 2013 in Boston. It was an incredible scientific program again, wonderful scientific sessions, student posters, a very inspiring Helen Rodriguez-Trias breakfast, and also a wonderful gala. It really gave me an opportunity to connect with mentees, mentors of mine, and just really have a joyous celebration of the 40th anniversary. And at that event, we also, thanks to Dr. Jose Pietro's sponsorship, we were able to record many of the Latino Caucus leaders' videos. You know, some of the lessons learned, they learned through APHA, Latino Caucus, 0 Words of Wisdom. So I hope you know Latino Caucus has a YouTube video. So I really encourage you to listen to some of those videos.
The Latino Caucus was full of energy and activism. We wanted to increase representation of Latino in public health field, which is an ongoing challenge. across the nation and also within APHA. We want to increase Latino health data and research, and we were constantly introducing policy to APHA during the late breaker resolution sessions. Some of the great experience in my journey with the Latino Caucus were knowing through the caucus all this impressive group of people who have similar dreams of achieving health equity in the Latino community. We engaged in advocacy work that led to CDC National Center for Health Statistics to change the birth and death certificate to include Hispanic identifiers. And finally, we were able to have data on the causes of death of Latino nationwide. We advocated to have Latinos involved in the Hispanic HAES, the National Nutrition Examination Study. Those efforts led to the hire of Dr. Fernando Treviño as a key research staff. We also mobilized to achieve that APHA had a first Latina president, Dr. Helen Rodriguez, and later on advocated to assure that the Latino Caucus breakfast be named as the Helen Rodriguez breakfast. All and many other achievements led to opening doors for all the Latinos to either run for APHA council or for APHA committee or for APHA president, as many of them did, and I admire them deeply for all those efforts on behalf of Latino and providing the appropriate Latino representation in key areas.
Chavez, then as he is now, was the legendary leader and founder of the United Farm Workers Union. Therefore, this disregard was really considered as a falta de respeto, which resulted actually in a series of events that have forever changed, I think, the history of the caucus and Latinos within APHA and beyond. It was called the Chicano Latino Caucus at the time, under the leadership of Vincent Garza. And the resulting outrage led us to go march on the governing council that was in session at the time. A resolution was drafted and unanimously approved by the governing council. It made demands on APHA regarding the participation of Latinos and other underrepresented groups within the association. That was the beginning of profound history and impact that the caucus has had, not only within APHA, but beyond in the field of public health. As a young Puerto Rican woman at the time from New York, I had been active in many social action movements, but the events of that meeting were so profound and influenced my formation and my commitment in such a way that I felt I really wanted to commit my professional life and career to addressing Latino national policy issues. And it turned out to be the case. Since then, for me, and I know for many of you there, the caucus has been really our boot camp for leadership within APHA and beyond. Just one comment. I would suggest that you might want to read the commentary that I prepared for the 50th anniversary supplement that the American Journal of Public Health is going to be publishing. It contains important history of the caucus and the important role it has played in the field.
A highlight of my Latino Caucus journey has been the opportunity to serve as co-chair of the scientific program between 2015 and 2018 with my colleague Dr. Barbara Vaquero. That role gave me the chance to give back to my Latinx colleagues and help shape the program that caucus members and the broader APHA community would see at our annual meetings. I want to thank Barbara for her partnership, Dr. Irene Martinez, who took over as co-chair afterwards, and to Dr. Tricia Miranda, who invited me to serve on this role.
A few good memories I have is moderating scientific sessions, las fiestas with food and music and dancing and lots of friends. And a particular highlight for me has been the publication in 2019 of the Latinx Salud Poems, an inaugural collection of some 48 poems by 17 poetas, and which I edited. And I hope we could perhaps soon publish a second collection.
During my tenure as the president of the Latino Caucus, I was able to convince APHA to publish and fund their first textbook on Latino health. Although Marilyn and I were the co-editors, the book was the collaborative product of the scholarship and work of several Latino Caucus members who contributed to this landmark publication. Latino Health in the U.S., a growing challenge. Let me read just the dedication portion. Con orgullo y cariño, this work is dedicated to the Latino Caucus of the American Public Health Association, its members, friends, and supporters, in appreciation for the role it has played in nurturing Latinos who have joined the ranks of public health and are working to address the needs described herein.
Over time, there were two experiences with a lot of work that I remember very fondly. First, working with Carlos Ometa in 2007 and 2008 to put together a scientific program, over the phone and at night. It was grueling work. The result was very good quality sessions and presentations. We were very proud. Later, working with Fanny Fonseca Becker as president, we had to meet again on the phone, this time on Saturdays, to get our incorporation done, which was the priority at the time. And I agree it was necessary, but grueling work too. There are two other experiences which are the fun ones that I remember. For some reason, they have stuck in my head. One of them is having a wonderful conversation with Jose Ramon Fernandez Peña over some coffee drink that he bought me. And I don't remember what the conversation was about, but I remember the day and I remember the coffee drink, and it was so much fun. The other one was going to the event and joking about how Pietro Aparicio always takes care of the awards. He is the one that does the awards every time. So the joke was that we thought that much like the Oscars, our awards should be called the Pietros para siempre.
One of the most memorable moments of being in the Latino Caucus, I served on the executive committee for about 4 years in the mid-2000s. One of our tasks was to put together the scientific program for the APHA conference. Along with my colleague, we wanted to expand the footprint, and we asked Donna to give us more scientific sessions and poster sessions. And I think she gave us 2 more sessions, and we were able to expand the number of sessions for the program.
The moment or experience for me that highlighted my journey with the Latino Caucus was definitely 2020, the year of the pandemic, the year of the lockdown, and us working remotely. The Latino Caucus, in addition to experiencing the challenges with the pandemic, was going through a total revamp. We were focusing our efforts on racial equity and building coalitions and relationships with other affinity groups in APHA and other organizations. We really wanted to expand our reach through APHA and beyond APHA. And this was the very year that we had the 4th most attended scientific sessions at APHA. We moved up from number 20. And we're a pretty small caucus with about 9 to 13 sessions a year. So this is a big deal. We also worked diligently and collaboratively to pass a late breaker policy statement, which was led by Danielle Montoya. In this particular policy statement, we were repudiating the non-consensual sterilization and health violations of female detainees at the Irwin County Detention Facility in Georgia. That year, we finally expanded our reach outside of the caucus, which was a very big deal because I think people mostly knew the caucus for having good parties and being a place where they could find comunidad.
Finding a place where they understood the importance of bringing health and wellness to my patients, to our community in a mass way. That was one of the most important things, and especially during COVID-19, where our voices were not heard, where we were seeing that a lot of our patients were the last ones to get tested, the last ones to actually get the vaccine. And, you know, a lot of barriers, but lifting all those barriers and knowing that I could call the network, the Latino Caucus members, and ask for help. Or the way around, they could call me like, well, Ilan, we need some type of communication efforts or creating that part. That network without the Latino Caucus would not exist. And it's the same powerful message that we have against depression, anxiety, the rates of obesity, and all of us can make a difference.
We stand in the shoulders of giants that saw the vision of the Latino public health. But now we have an emerging and wonderful group of leaders that are taking the caucus to the next 50 years and reimagining and rethinking all the things that we can do. So I cannot wait to celebrate, and congratulations to all of us for this great accomplishment.
I remember Lisa Maldonado was the president at that time. I immediately got invited to their events, and from that year on, I had been connected to the caucus because I felt at home. We share the same passion for public health, very similar histories and backgrounds, and we have very similar goals. What I cherish the most is that at every meeting and every event, we take our hats off, leave our differences behind, and unite as one family with the same goals, which are teaching, supporting, and mentoring the new generation of Latino public health professionals. And also, we unite in advocating, protecting, and fighting for the well-being of our vulnerable, disadvantaged communities, in particular, the Hispanic communities.